Well, in the face of a mental health pandemic in South Africa, the 5% share of the national public health budget allocated to mental health care is not only woefully inadequate, but could be better invested in the prevention and care at primary health care and community level. This is the sentiment of the South African Society of Psychiatrists and a message, or rather warning that they're sending to the South African government following that budget allocation that they deem to be insufficient. Dr. Kagiso Maaroganye is a convener at the Society of Psychiatrists, and he joins us now on the agenda. Very good morning to you, and thanks for making the time this Sunday.
Good morning, ma'am. Thank you for having me on.
What does this 5% translate into just in terms of financial terms, and how does it impact the work of the South African Society of Psychiatrists?
Yeah, generally speaking, all over the world, there's a decrease or a minimum amount spent on mental health, and this is a concern for not only us in South Africa but all over the world, because psychiatrists, psychologists, and everybody involved with mental health feel like a lot more should be spent on mental health in order to address the scourge that we have in society. I think all too often the budget has always been set up towards managing physical conditions, which are important, but mental health is also quite important. And we're feeling that the more spent on mental health, the more you can get back. So, for example, for every $1 spent on mental health, you can get $4 back in terms of better functioning and productivity. So what we're trying to say to the government is that if they spend more on mental health, increasing the 5% to a higher figure, then they may find that the community is more productive and functional.
And what you're saying is not only on the part of government, even with individuals. In a time such as this where mental health is highlighted so much, why do you think that mental health services are such a garage purchase?
Yeah, so I think that the first thing is that we have been set up to believe that the only time your health is at risk is when you're physically impaired or you're injured. But when you have mental illness in terms of not sleeping well, having depression, losing interest in activities, people don't think that it's so important. But the fact of the matter is that mental health is becoming a leading cause, or mental illness rather, the leading cause of disability. So people need to start understanding that if they're not mentally well, they may get cognitive impairment like poor concentration and forgetfulness. Even their relationships with people may start getting affected. And if you're not sleeping well, you're not going to be productive at work. So it needs to be one of those sort of must-have purchases. But the other problem is that there's competing, obviously, priorities. People are looking to have food on their table. People are also looking to maybe transport costs. So mental health becomes a lower part of the priorities, and that's why we need government to step in where people feel that they cannot spend their own money to go look for a psychiatrist and psychologist. Mm-hmm. I think it's our social responsibility to be available to the general population, and so that they can come to us and get help.
In your statement, you call it the mental health pandemic. Just give us and our viewers a sense of the mental health situation in South Africa, and are health practitioners managing it? Is government managing it? Do we know how to deal with it?
Yeah. So anecdotally, most of our colleagues will tell you that they've seen an increase in the number of admissions with psychiatric conditions since the time of the pandemic. Internationally, they say that every time there's an emergency, there's a 25% increase in people who need mental health care. Even in South Africa, in 2020, about 8% of people had emotional distress, but now it's gone up to 36%. So a lot of people have developed some emotional distress, if not mental illness like depression and anxiety. Yep. And the reasons are varied, social isolation, job losses, threats to one's life, and, in some cases, there have been deaths in the family. So all of these matters have increased the amount of mental illness or emotional distress in the population.
So what are your concerns as an association about the allocation announced by the Minister of Finance on Budget Day, and how are you interacting with government just to ensure that your message gets through?
Yes. So what we're finding is that over 80% of the budget is traditionally being spent on hospitals, because that's where patients go when they're not ill, either they're suicidal or violent. So, but a lot of it has been spent on hospitals. So what we're saying is that we need to redirect that budget so that a lot more is spent in the community. So by the community means that there will be more psychiatrists, more psychologists close to where the patient is. So you would expect if I just walk 5 kilometers and there's a clinic, in the clinic I must find someone who can help with my mental illness, and then there must also be psychologists and social workers. And indeed, in terms of the Gauteng government, they have made some inroads as far as they're concerned. Since 2 years ago, they employed a whole lot of psychiatrists, medical officers who have got experience in psychiatry, psychologists and social workers, and they are in the community. So if I'm ill and I've got depression in the community, I no longer have to go to the hospital to see a psychologist or to see a social worker or even an OT. So this is a model that we think works, and then we feel that it should be spread all over the country. Obviously, more can be done in terms of having resources and office space and so forth.
You also quote the latest Mental State of the World report that you says South Africans' mental well-being is the lowest in the world, with the country's mental health quotient at 46 to 100, a decline of 3% from 2020. Are we really the lowest in the world? And just what are the sources of mental health among South Africans?
Yeah, that is quite believable. I think we need to change our perception of what is constitutes mental illness. So I think traditionally, when we think of a mentally ill person, we think of somebody who's basically homeless, somebody who's walking the streets, picking up rubbish from the dustbins, somebody who's violent, somebody who's suicidal. That's a classic view of mental illness. But what we find, especially at the primary care level, is that people who just look like you and I may be harboring some suicidal ideas. They may not be sleeping well, and a lot of people may be using alcohol to cope. So there are a lot more patients who look like you and I who need mental attention. So maybe that's why society feels that it is not such a problem, because if you maybe take one person who's homeless, you think that everybody else should be fine. If you think about it, and the stats do say there's 1 in 3 people in South Africa that got some sort of common mental illness. But common mental illness, we talk about depression, anxiety. So for every third person that you see, you can suspect that they may have a mental illness. So I do believe that quotient, ma'am.
So as the Society of Psychiatrists, one imagines that you do want patients referred to you. But do you also contribute in the effort to find solutions to mental health? And can you break down some of those projected solutions to us?
Yeah, so the common solution that we have is medication. So we use medication in order to treat even depression and anxiety, but it's also talking therapy. So that's where the psychologist comes in as well. So a lot of people may have some negative thoughts about themselves. They feel like they're always a failure in life, whereas when you look at their lives, they're not really done so badly. So we look at changing their cognition. Also with the social work, you find that if you're having some marital problems or family, unfavorable family dynamics, we can get the social worker to come in and help you. So it's just not only medication, there's a whole set of things that we can do. Obviously, if you get very ill, then we can give you electroconvulsive therapy and those sort of conditions or injections. But even before that, we need to start promoting mental health. So one of the things that we were doing during COVID was saying that people must eat more nutritionally, people must exercise more, and they must not isolate themselves as much, because if you do that, then you develop emotional distress. So we're hoping that part of the budget is going to go towards promotion of mental health as well as prevention of mental illness.
Of course, many conversations that can be had about mental health, but in this particular instance, we're talking about mental health with regards to the allocations that were given by Finance Minister Enoch Godongwana during the week in his budget speech. Dr. Kagiso Maaroganye is a convener at the Society of Psychiatrists, and we thank you so much for your time.